A comprehensive guide on how to help a person with Diogenes Syndrome. Diogenes Syndrome is a mental disorder that is characterized by extreme hoarding, filthy living conditions, and social withdrawal. It often occurs in older adults who lack adequate social support and who are living in poverty. It can be difficult to help someone with Diogenes Syndrome due to their lack of motivation and social support. The key is to create a supportive, non-judgmental environment in which they can feel comfortable and safe. This includes providing access to mental health services and resources, helping them to clean up their living space and providing emotional support. Additionally, it is important to ensure that they are receiving the necessary medical and social care they need to manage their condition. With patience and understanding, it is possible to help someone with Diogenes Syndrome to improve their quality of life. Symptoms of Diogenes Syndrome. Many people with Diogenes Syndrome are unable to have a job or participate in the community due to their condition. Consequently, they are often homeless and live in substandard conditions. Other symptoms of DSI can include extreme hoarding, no significant medical or psychiatric condition, social withdrawal, poor hygiene and lack of hygiene products, inability to manage money, extreme stubbornness, lack of motivation. Causes of Diogenes Syndrome. The causes of Diogenes Syndrome are not fully understood, but it is often associated with family trauma. Studies have found that women who were abused as children were significantly more likely to develop DSI. Additionally, studies have found that people who have a relative with the condition are more likely to develop it themselves. Furthermore, researchers have found that people with DSI have low levels of serotonin, a neurotransmitter that plays an important role in mood, cognition and sleep. As a result, they are unable to process social cues and often feel isolated and anxious. Creating a supportive environment. The key to helping someone with Diogenes Syndrome is to create a supportive environment. This means providing access to mental health services and resources, helping them to clean up their living space and providing emotional support. Additionally, it is important to ensure that they are receiving the necessary medical and social care they need to manage their condition. With patience and understanding, it is possible to help someone with DSI to improve their quality of life. Creating a supportive environment for a person with DSI can pose challenges. In order to create a supportive environment, it is important to understand how they think and how they feel. Additionally, it is helpful to create a non-judgmental, low-pressure environment where they feel safe and supported. To create a supportive environment, it can be helpful to undertake the following. Create a low-key, calm environment. Avoid strenuous verbal communication, excessive attention and annoying behaviors that may upset a person with DSI, e.g. loud noises, bright lights, excessive clutter, etc. Avoid pressuring a person with DSI to engage in routine daily activities. Avoid trying to get a person with DSI to bathe, eat, take medication, etc. Avoid trying to get a person with DSI to participate in activities in which they have no interest. Provide a person with DSI with tasks that have meaning. For example, a person with DSI may enjoy taking care of plants or cleaning. A meaningful task can help encourage them to interact with others and engage in activities that they enjoy. Ensure that a person with DSI has a supportive community. For example, an older adult with DSI may enjoy the company of other older adults who also have DSI. When possible, connect a person with DSI to other individuals who have DSI and provide social support. Ensure that a person with DSI has resources. For example, a person with DSI may enjoy reading. Providing books and materials for reading can help motivate a person with DSI. Ensure that a person with DSI has privacy. For example, a person with DSI may enjoy having a private bedroom. A bedroom can be a source of privacy and can help reduce the risk of a person with DSI feeling pressured by others to engage in social activities they do not wish to participate in. Accessing mental health services. In order to manage their condition, it is important for a person with DSI to see a mental health professional. In addition to this, it is important to access mental health services as soon as possible. Early intervention and treatment is critical in the management of mental health disorders, including DSI. As such, it is important to seek help as soon as possible. Early intervention is particularly important for people who have a family history of DSI since it may allow them to prevent the disorder from progressing. Additionally, it can allow them to manage their symptoms and prevent future outbreaks. The key to accessing mental health services is to find a mental health professional who is accepting new patients with DSI. Cleaning up the living space. Cleaning up the living space of a person with DSI can be a particularly challenging process. In order to clean up the living space of a person with DSI, it can be helpful to undertake the following. Prioritize the cleaning of the most significant areas. For example, the most significant areas of a person with DSI may include their bedroom, kitchen and bathroom. Additionally, it may be helpful to focus on these areas in order to free up space in the other areas of the home. Work in small manageable chunks. For example, a person with DSI may find it difficult to clean the entire house in one go. It may be helpful to break the cleaning process down into manageable chunks. Ensure that a person with DSI has a supportive environment. For example, a person with DSI may enjoy the company of other individuals who also have DSI. When possible, connect a person with DSI to other individuals who have DSI and provide social support. Ensure that a person with DSI has resources. For example, a person with DSI may enjoy reading. Providing books and materials for reading can help motivate a person with DSI. Ensure that a person with DSI has privacy. For example, a person with DSI may enjoy having a private bedroom. A bedroom can be a source of privacy and can help reduce the risk of a person with DSI feeling pressured by others to engage in social activities they do not wish to participate in. Providing emotional support. Emotional support is an essential part of the process of helping a person with DSI to manage their condition. It can help to manage their symptoms, ensure that they are accessing necessary care, and prevent negative outcomes such as depression and suicide. The most important thing a person with DSI can do for themselves is to seek help. It can be helpful to someone with DSI to recognize when they need help. It can be helpful for a person with DSI to recognize when they need help. For example, someone with DSI may find it helpful to ask themselves, "Do I feel like I need help?" It can be helpful to discuss this question with a friend or family member so that they are aware when they need help. Discuss their barriers to accessing help. It can be helpful to discuss a person's barriers to accessing help, such as their finances or the availability of mental health care. It can also be helpful to discuss their social and emotional barriers to help them to recognize and address these. Identify resources that can help them. It can be helpful to identify resources that can help a person with DSI to access help.